So you know what body dysmorphic disorder is? It's this mental health thing where you get super fixated on what you think are flaws and how you look. But get this, these flaws might seem like no big deal to everyone else. So imagine feeling shame or disgust about certain body parts. It's like these emotions turn into a full-on obsession. You end up doing stuff like constantly checking and comparing that supposed flaw, and seeking reassurance becomes your daily workout, taking up a ton of your time. And here's the kicker. You might start dodging social situations like a ninja to keep that flaw under wraps. It's like adopting these funky routines just to avoid anyone noticing what's bothering you. Crazy, right? It's like your brain goes into overdrive about something others might not even notice. Mental health is a wild ride, my friend. Getting to the bottom of BDD, what makes it tick? Alright, let's break down why body dysmorphic disorder happens. We're on the case, investigating the causes. It's a bit like solving a mystery. Brain differences, our unique brain blueprint. First up, we're looking at the brain. Think of it like a puzzle. Some studies suggest that how our brains are put together might have something to do with BDD. It's like our brains are doing a little dance of their own, and that dance could be connected to how we see ourselves. Genetic predisposition, family connections. Next, we're talking about family ties. If someone in your family has dealt with BDD before, it's like a signal that there's a higher chance of it showing up in your life too. It's a bit like passing down a special trait, but in this case, it's not one you'd want. Environmental influences, life's impact on how we see ourselves. Life plays a big role in this story. Negative judgments about our looks, tough times in childhood, and always aiming for perfection, they all add up. It's like the environment we grow up in shapes the way we see ourselves, sometimes not in the best way. Spotting the signs, how BDD shows up. Okay, let's talk about how body dysmorphic disorder raises its flag. It's like a list of clues that might make you think, something's going on here. Obsessive focus, the never-ending mirror check. First off, there's this constant checking. Imagine someone spending hours just staring at themselves in the mirror, comparing every little detail. It's like they're on a mission to find flaws, and it becomes a bit of an obsession. Avoidance behaviors, dodging the limelight. Next up, there's this avoidance thing. Picture someone adopting strange routines or steering clear of social situations, all to keep those perceived flaws hidden. It's like they're putting up shields to protect themselves. Emotional distress, feeling the heavy stuff. Now, emotions come into play. Feelings of shame, disgust, and anxiety sneak into everyday life, making it a bit of a challenge. It's as if specific body parts become a source of emotional turmoil. Negative body image, the unshakable doubt. Despite what others say, there's this persistent doubt. It's like a stubborn thought that the perceived flaw is real, even when everyone else sees something different. Accepting reassurance becomes a tough nut to crack. Common obsessions, zooming in on the details. Here's where it gets specific. BDD has these common obsessions. It's like a checklist of what someone might be overly worried about. Facial features. Nose shape, wrinkles, acne, and complexion become focal points. Hair and skin. Worries about losing hair or skin imperfections take center stage. Muscle size and tone. There's a constant preoccupation with how muscles look. Breast size and buttocks. The focus shifts to body proportions, especially concerning breasts and buttocks. Genitalia. Anxiety sets in about the appearance of genitalia. Getting to the bottom of it. How BDD gets diagnosed. Alright, let's talk about how doctors figure out if someone's dealing with body dysmorphic disorder. It's like putting together pieces of a puzzle to get the full picture. Diagnosis. The chat with the doctor. So, healthcare providers use a fancy term called a psychological evaluation. It's like a friendly conversation, but with a purpose, figuring out what's going on. They follow some standard guidelines, asking about symptoms, digging into your history, and seeing how BDD is playing a role in your everyday life. Now, imagine it like this. It's like telling the doctor your story, and together, you both figure out what might be causing those thoughts and feelings about your appearance. Treatment options, tools to tackle BDD. Once the diagnosis is in, the next chapter is all about treating BDD. It's like having a toolkit with different tools to help you on your journey. 1. Medication. Fluoxetine to the rescue. One tool in the toolkit is medication like fluoxetine. It's a type of antidepressant that falls under the category of selective serotonin reuptake inhibitors. These guys can be superheroes in managing those gloomy feelings that often come with BDD. 2. Cognitive behavioral therapy. The talk that makes a difference. Now, another powerful tool is something called cognitive behavioral therapy, or CBT for short. It's like having a chat with a guide who helps you challenge those not-so-great thoughts and change behaviors that are causing emotional distress. It's a bit like rewriting the script in your mind, taking care of you. Simple steps on the self-care path. Alright, let's talk about looking out for yourself while you're on the journey to tackle body dysmorphic disorder. It's like having a little self-care toolkit to help you along the way. 1. Skip the booze and drugs. Clear the path to healing. First off, steer clear of alcohol and drugs. They can be like tricky obstacles on your path to feeling better. Substance use might make those BDD symptoms worse, so it's like giving yourself a break from things that could make the journey tougher. 2. Get moving. Exercise for the mind and body. Next up, get moving. Regular exercise isn't just good for the body. It's like a mood booster for the mind. It's as simple as taking a walk, doing some stretches, or finding an activity you enjoy. It's a little step that can make a big difference in how you feel. Seeking professional support. A hero in your corner. Now, here's the important part. While you're taking care of yourself, don't forget to team up with a professional. Reach out to a psychiatrist. They're like your guides on this journey. They can give you personalized advice and support that's tailor-made for you.